Hello, and welcome to our program today that will focus on the Arthritis Foundation and who we are. My name is Lee Lewis, and I am the Community Development Director for the Southwest region here in Florida. We are a volunteer-led, nonprofit agency. The Florida chapter raises over $4 million annually through the generosity of you, the public. 85 cents of every dollar raised directly supports our mission, research, and programs. Today, we wanted to focus on juvenile arthritis, and we are very fortunate to have had the opportunity to bring together a pediatric rheumatologist from Shands Hospital, University of Florida, Dr. Renee Modica, along with Jackie Hafner, who is a professor of nursing at St. Petersburg College, who has a 7-year-old daughter by the name of Lily, who was diagnosed with JRA at the early age of 16 months. Also joining us is Norma Liebert, pediatric rheumatology at All Children's Hospital. We really want to bring attention to how unacceptable arthritis is and what we can all do to help raise awareness and reduce the unacceptable impact of arthritis, which strikes 1 in every 5 adults and 300,000 children and is the nation's leading cause of a disability. Arthritis carries a staggering cost of $128 billion annually in medical expenses, lost earnings, and reduced productivity. The next 2 individuals I wanted to introduce you to are getting ready to make an impact in our fundraising arena with Jackie Hafner in their quest to compete in Race Across America, making up Team Bacchetta, Racing for Kids with Arthritis. The cycling challenge will start from the pier at Oceanside, California, and finish at the City Dock in Annapolis, Maryland. And 75% of these donations going directly to support the Arthritis Foundation's programs and services. John Schlitter, who is product development and testing with Bacchetta Bicycles in St. Petersburg, Florida, and Lisa Avila, chief for the Team Bacchetta's relay team. The race begins on June 16th and is an 11-day race, but Team Bacchetta's goal is to finish this race in only 6 days. Later on in the program, we want to share more details about this fundraiser. And from here, I wanted to ask Dr. Modica, who is one of our special guests today. First of all, could you just introduce yourself and tell us a little bit about your practice and the kind of patients that you'd see?
Yes, thank you for having me here today. My name is Dr. Renee Modica, and I work at Shands Hospital in Gainesville, along with Dr. Melissa Elder and Dr. Sukesh Sukumaran. And I also work with other colleagues in Florida. Dr. Nickerson is in Tampa, St. Petersburg area, and there's other adult rheumatologists who also see pediatric patients. And we're from a small community, as you may or may not be aware. There's not a lot of pediatric rheumatologists in the world, the U.S., or in the state of Florida, so it is an honor to be here today.
Thank you. And just working, I've been with the Arthritis Foundation a little over 6 years, and that's one of the things that I've learned, that we just don't have enough people that do what you do. And
yeah.
So appreciative. Well, you kind of went over how many patients. How many patients do you actually see, would you say, at your practice?
Well, because there is a shortage of pediatric rheumatologists, we do see patients not only in Florida, but also surrounding states that don't have a pediatric rheumatologist close by. We probably have currently about 3,000 to 4,000 active patients in our practice.
Wow.
And Norma and I were just discussing before the show that, we get several, 100 or so referrals a week to see new patients. So there is a great need, which also, provides a big blocking point for access to care, unfortunately, for patients.
Yes.
Because there's a great need, but not a lot of people to see the patients.
Mm-hmm. Yep, that's what we're trying to help do, huh?
Yeah.
And I wanted to know where you travel from, and I know that you do travel a bit of a distance to do what you do.
Yeah, I work at Shands Hospital, but I live in Orlando. I do work part-time with my other colleagues, and I do an outreach clinic in Orlando as well. In the past, we've also had outreach clinics in Daytona, and I know that you guys also do some outreach in Sarasota, but work primarily in St. Petersburg. So we do have some unique challenges to try to provide more access to care so families don't have to travel as much. Another possibility is that some patients do see adult rheumatologists as well, who help provide care. Steve Goodman is another adult and pediatric rheumatologist on the East Coast who also sees patients. But yeah, we sometimes, I travel about 2 hours to go to work and 2 hours back. So,
oh boy, amazing. I know that I know just again with being with the Arthritis Foundation, there are many kinds of arthritis. And could you kind of give us an idea of how many kinds of actual juvenile arthritis types there are?
Yeah, there's juvenile arthritis. It used to be called rheumatoid arthritis, but now we've changed the name to idiopathic to denote that we don't really know what causes it. Rheumatoid sort of reminds people of the adult patients who get rheumatoid arthritis, which is a little bit different. We do have some pediatric patients who get an adult-like arthritis, but juvenile idiopathic arthritis is a little bit different. It has a different associations with it, and I can get into that in a little bit. But arthritis can also be part of other autoimmune conditions. So as a pediatric rheumatologist, we treat patients who get autoimmune diseases, and that basically means is that your immune system is imbalanced. Your immune system is the part of your body that helps protect you from things, infections, cancer, autoimmune diseases, but when it can't see that there's a problem there, then it can attack your own part of the body. It's almost like it's confused, and that's basically what leads to autoimmune disease. So arthritis can also be present in other autoimmune diseases, things like lupus or vasculitis. You obviously are familiar with those, but for juvenile arthritis, they divide it into different types. You can have a small number of joints involved, which we call oligoarticular, many joints or polyarticular, and then there's systemic arthritis that affects it's associated with systemic features such as fever and rashes and things like that. And then there's other names of arthritis that affect the spine called ankylosing spondylitis or juvenile ankylosing spondylitis. Arthritis can be associated with psoriasis, inflammatory bowel disease. It can occur after infections. So there's probably, it'd be hard to put a number on it, but those are how we categorize and look at those types of things.
I wanted to also ask you what the difference is between JRA and JIA.
Yeah, well, I sort of alluded a little bit there that JIA, the I stands for idiopathic, so juvenile idiopathic arthritis, and that term means that we don't know the exact cause. We have an idea, we know the immune system's not well balanced, but the rheumatoid is really a historical term, and I think, it came from the adult rheumatoid arthritis, which basically means more like there's a rheumatic disease, but the pediatric community changed the name to idiopathic because the juvenile rheumatoid arthritis tend to have a different disease course and prognosis than adult rheumatoid arthritis. A lot of adults with rheumatoid arthritis tend to get a lot of wrist involvement. It tends to be very destructive and deforming type of arthritis if it's severe, and not all children follow that pathway. There are a portion that do, but so that's why we, as a community worldwide got together and changed the nomenclature.
Okay. That's, it's also so absolutely amazing. What would you say are the first symptoms that a parent or a child might notice that they might think, to actually go seek out a rheumatologist?
It's a really good question, and I'm sure you're going to share a little bit about that, your experience with your daughter. But one common symptom, a lot of people think that arthritis is painful, and it is, but a more important symptom is stiffness, which, because this is an inflammatory problem, so the immune system is not where it's supposed to be. It goes into the joints, and it causes an inflammatory response in the joints. So with all those extra inflammatory things in the joint, when a patient is sleeping at night or is in a car ride for a long period of time, they'll have stiffness. Children still like to do what they want to do, so even though they may be experiencing pain, they're very clever and they may compensate for it. And the way that they compensate is they'll modify their activities. So a lot of times parents, it may take a few weeks to months to notice that they're actually in pain because they've developed a clever way to work around it. More obvious symptoms would be, they might notice that a joint looks swollen or feels warm. That's part of the inflammation. But a limp is often a very common symptom. And that usually has been that means that the arthritis has been present for quite a long time for the patient to start limping. So that's probably the most common reason. You probably agree with that, right?
Absolutely.
That we see people coming in. They also develop difficulties with their daily activities, things like writing, if they have problems with their wrists or their fingers, if they were an older child, maybe in a sport, the coach might notice, oh, you're having some trouble, running around the base or hitting the baseball or catching. So it tends to affect activities that they do. And what happens is over time, because they don't use their joints normally, their range of motion gets decreased. So that's another common thing that we see, that they can't bend their wrist entirely. They kind of will write differently if they have wrist involvement. So those are more common symptoms that a parent or a physician might notice.
Yeah, I know some of the things that when we've had people, just literally off the street come in and ask us some questions, and that's one of their frustrations is it's taken so long for this to be diagnosed, like they're going to their primary care or whatever. And
people think of arthritis as an old patient. Or an older person's disease, and clearly there are elderly patients who do have arthritis. People are mostly thinking about degenerative arthritis, which has to do with the wear and tear of the cartilage in the joint. But the autoimmune arthritis has to do more with, again, the immune system being confused and attacking the joint, almost like there's an infection in there and causing all this swelling and thickening of the joint and really impacting the function of the joint in a different way. So you're right, it's lack of awareness that's a bigger problem sometimes, and as I was getting to before, a lack of access to care. The pediatrician may suspect it, or the physician may suspect it, but there's nobody in their neighborhood for miles, so it does create a problem.
Or they just be in denial, even a parent not meaning to, but because I have a child, there couldn't be arthritis.
I think one of the unique problems in pediatrics is that the child is still developing. So if the arthritis occurs somewhere along in their development, while they're starting to crawl, it may look like a different problem, like a neurologic problem or a developmental problem, rather than a pain or an arthritis problem. And then you also have it if it's occurring in a younger child, and I'm sure you experienced this with Lily. She maybe wasn't talking. She was 16 months. She was quite young. They can't tell you what's wrong. So you have to be a really good observer in order to figure out that that's what's happening. So,
can you tell us a little bit about? I know there's so many wonderful new medications that have come along. Can you give us an idea of some of that?
Sure. Well, there's a lot of newer medications that have come out, but typically, because it's an inflammatory problem, an anti-inflammatory such as naproxen or Aleve or ibuprofen are common anti-inflammatory agents, and those help treat the symptoms of arthritis, the stiffness, the pain, and some of the inflammatory proteins that are there. But really, as I was getting at before, this is an immune system problem. So the immune system, if you think of it like a scale, is almost tipped in the wrong direction. It's too active. So the medications to treat juvenile arthritis are really more medicines that rebalance the immune system and put the immune system, actually suppress it somewhat, and so that the functioning part of the immune system can then, essentially fix the problem on its own. And there are medicines that make the immune system a little bit smaller. We actually use a medicine called methotrexate that in patients with cancer is actually a chemotherapy drug, but when we use it in the setting of arthritis, it's an anti-inflammatory drug, and it does make the immune system, in a sense, to simplify things, a little bit smaller. Then there are a ton of newer medications which we call biologic medicines, and those biologic medicines are engineered to attack different parts of the immune system. So I like to use the analogy of your immune system is like an army, okay? And you have bosses of the army that give signals to the troops, and then the troops, fire the weapons essentially. Well, in the analogy of arthritis, it's the generals, the troops, and then the inflammatory proteins. So there are different biologic medicines that target different parts of the immune system along the way where that inflammatory process leads to, and targeting those inflammatory proteins, targeting the signals between the bosses of the immune system and the troops of the immune system, and those are all newer medicines that have come out in the past couple of years, actually the past decade, I would say, that have made a significant difference in the quality of life for patients, as well as their ability to get their disease under control with the medicines, excuse me, or even in remission, which is something that we really are trying to get with our patients.
Yes, we had not too long ago at the end of one of our fundraising events, we like to do like a thank you celebration, and it was interesting. We had a woman who's had arthritis since she was 30 years old, and now she's in her 70s, and then we had a teenager, and then it went down, and you could see just the amazing things that have happened since the older patient had been treated with gold shots, for example, for years ago, to now, and the teenager who had actually had, I think she was the youngest person to have a knee replacement, because obviously you wait because they're still growing and that kind of thing. But just to see the amazing things that have happened was, mostly there wasn't a dry eye in the whole crowd that night, so it was really, really neat. Let's see, what do you think is the most needed to improve the lives of kids living with juvenile arthritis?
I think people who can care for them. There's a significant need for pediatric rheumatologists, people to train into pediatric rheumatology, pediatric rheumatology nurses, staffed, because a lot of the medicines that we use, require a lot of phone calls to get those things in place. They're quite expensive medications. Reimbursement's an issue. So funding is a major issue. Families often can't afford some of the treatments that we know will make a difference to their lives. So I think all those things are really important. I think on the other side is education, getting people aware of the problem, what it looks like, when it's developing. By the time we see them, it's obvious to us, but it's that leading up to stage that's difficult for sometimes physicians or parents or families to recognize. And getting rid of that misnomer that arthritis doesn't occur in kids. It does, and so getting that message out there. I think the other thing that would make a big difference is having support for families who are dealing with this, because these aren't common conditions. Juvenile arthritis, out of the rheumatology conditions, is probably the most common, but they're still not very common. As you said, there's 300,000 kids in the U.S. who get this, which is still a lot, way too many. But having somebody who is going through that, I think, would make a big difference for families.
Oh, absolutely.
So.
Yes, absolutely. That's why I think what we do at the Arthritis Foundation, obviously one of the biggest things, the fundraisers, as these wonderful people that are here today that are going to help us do, is bring awareness, because I don't think that arthritis pulls at the heartstrings like cancer or and people are so aware of children with diabetes and that kind of thing. So try so hard to get the awareness out there. So I wanted to ask a little bit, because Jackie Hafner, who is here, her daughter Lily is one of your patients, who's just 7 years old, and kind of wanted to see maybe how long you along with your partner, I believe, have been treating Lily, that kind of thing. If you could just go into a little bit of that.
Sure.
Okay.
We've been treating Lily since about 16 months. She started presenting with symptoms around that time?
Yeah, she was diagnosed at 16 months, and then we spent the first 2 years after diagnosis at All Children's, and then transferred over to UF with your practice.
Yeah, I think she's, again, similar. We were talking about, some of the medications that patients will go on. Lily has been on those medicines, the anti-inflammatories, a small dose of methotrexate, and then a biologic medicine called Enbrel, which has really made a big difference in, and actually last year she had actually come off her medicines because she was doing well for a year, but like many other patients, it can develop symptoms again, so that's where we are right now with her care.
Right.
So.
Well, I was wondering, Jackie, if you could tell us just a little bit about how it was and is raising a child with arthritis and some of the everyday struggles that you have.
Sure. Lily was 16 months and normally developing at that time, running around like a normal toddler, and she developed a swollen ankle that one of her preschool teachers noticed one day. She wasn't limping, there were no other symptoms, and I couldn't come up with a reason. She didn't say ow when I pushed on it, and I'm a nurse and just knew there had to be something wrong. I didn't know whether she'd fallen, and no one had noticed, but I took her to her pediatrician that same day, and she immediately thought perhaps it might be some form of arthritis. She considered post-streptococcal arthritis, that perhaps she'd had a strep infection and we didn't know about it. And so she hospitalized her. And you know, now looking at it years later, I just realized how lucky we were that all of that took place, because the pediatrician told me she had never had a child diagnosed with JRA. She'd never seen it before, but something made her suspect it. So because she was hospitalized, they ran all the tests, and within 3 or 4 days we had a diagnosis. And we were so lucky to be right next to All Children's, where there was a pediatric rheumatology group. And within 2 weeks, it had gone from that one, you know, asymptomatic swollen ankle to she couldn't move. So it hit both ankles and both knees and all her fingers and her neck and her elbows. It was pretty much all major joints. And we were desperate, you know, we didn't know what to do, because she just screamed all the time. She was in so much pain. And so they put her on methotrexate very quickly within the first month. And we struggled with that for about 6 months with no relief. We just didn't see any response to it at all. And you know, as a nurse, of course, I did all this research on the methotrexate, and not only did I read about the potential for toxic effects, side effects, but I was seeing it. She would get sick every time she got the shot. So I actually chose to give her the shots during the night, because it was so traumatic to do it while she was awake. And then she would, within 12 hours, start vomiting, and we would experience that for, you know, several hours after that. And so this was weekly for months. And I remember very well going to Norma and just saying, you have got to help us. You know, we can't go on like this. I'm not going to keep giving her injections when it's not helping her. We were going to physical therapy and occupational therapy to try to keep some kind of motion going, because the more still she was, the more painful it became. And eventually, I think about the 8th or 9th month after starting methotrexate, we did start to see some relief.
Wow.
And we continued on that for another year, when there was significant relief. And we decided to drop the dose down, and immediately she flared and everything came back again. So we went back on the methotrexate, and we never did get back up to that comfort level.
How old was she at that point?
She was about 2.5, 3 at that point. No, she would have been about 3.5 at that point. So, you know, there was talk about starting her on Enbrel, but at that point in time, I think, you know, every pediatric rheumatologist thinks differently about when you should start that. I think the suggested starting age was 4 and over at that point, based on drug trials that had been done, because of course they don't test these drugs on children. So somebody referred us to the practice up at University of Florida, and I just decided I would go up there and see what they had to say. And it was Dr. Modica's partner, Dr. Elder, that saw her for the first time, and she suggested we start her on Enbrel right away. And we did, and within 2 weeks, there was a significant difference, a significant reduction in swelling, and within a month, everything was moving. I mean, it was seriously miraculous. And I know it's not like that for everybody, but for Lily, that change in drug regimen made all the difference in the world. So that's been, what, 2.5 years plus now, and she had had no symptoms at all. None. Since she started Enbrel, she has been completely symptom-free. She, up until several months ago, nobody knew she had arthritis anymore. You know, people didn't believe it when I told them this child was disabled a few years ago. But, you know, we had
we had reduced her medication, reduced the Enbrel, because we, as parents, we wanted to do that because we didn't want to keep giving her drugs unless we really had to. So we reduced it, and unfortunately, fortunately, we tried to take her off completely, and within 2-3 weeks, there was some mild swelling going on, and we kind of figured, uh-oh. And then we waited another 2 weeks, and then there was significant swelling. Just one of her knees blew up. So obviously the disease is still there, and the Enbrel was just enough to keep it at bay. So she's back on again, and she's doing great. Within 2 weeks, she reacted really well to it. And at this point in time, I think that's where we're going to stay. But I will tell you that I feel for every parent that has to go through that diagnosis. I feel incredibly lucky that, one, I was in the medical community and knew enough to recognize the little bit I did, and very appreciative of her physician who diagnosed it so fast, of our care at All Children's, and specifically Norma, who, so often, I say this, and I'm a nurse, so I know it's going to seem like it's biased, but nurses spend a lot of time with patients, and in this particular setting, she was our lifeline, because the Dr. Nickerson, who's fantastic, came in and he gave us the diagnosis, and then he left and said, "Okay, Norma, take care of the parents." And as a parent, you kind of suck that in, especially being a nurse. I feel like, okay, it's all right. We're just going to suck this in, and we're going to figure out how to fix it. And of course, you can't fix it. And so during that first appointment, when the diagnosis was made, Norma sat down, looked like she didn't have another patient to see in the world, and she took the time to talk about the injections. And she didn't talk to me like I was a nurse. She talked to me like I was a parent who'd been diagnosed, or whose child had been diagnosed with, a pretty horrible disease. And that got us through. Month after month after month, through those desperate first 6, 7, 8 months, she is who got us through. So, having said that, Norma, I'm going to put you on the spot now and just ask you. I know that. Make me cry. I know that first year you told us about a conference where parents of newly diagnosed kids could go and learn from pediatric rheumatologists from around the country, and also could talk to other parents and find some support there. We did that. So if you would talk about that, just for perhaps some other parents that might be watching this that have not attended, and then any other forms of support that you either suggested to us then, or perhaps that have come across since then, that would be great.
All right. When our families come in and they get the diagnosis of arthritis, it's like a roller coaster. They just, and you're not going to be able to tell them everything they need to know in that first session. And it's kind of an ongoing roller coaster ride up and down as the families get to know and understand a little bit more about the arthritis and the medications and what's expected of them. And these families, I'll tell you, they're my heroes. They just, every day they amaze me with their resilience and their courage, because these are tough diseases, all the juvenile arthritis diseases. And I always recommend going to the national conference. The Juvenile Arthritis Alliance has a conference every single year. This year it's going to be in St. Louis, July 19th through the 22nd. And it's a fabulous conference because families get to go there. They take their kids, and it's like a big vacation that they go to, and they get to meet other families. The kids are in sessions with other kids. There's a huge children's program. And when we had it here in Orlando several years ago, I coordinated the children's program. We had 12 different age groups, and the kids get to meet other kids and realize that they're not alone. They're not the only ones that are dealing with this. And parents also get a chance to meet other parents and learn from the leaders throughout the entire country who are working on kids with arthritis. So it's a wonderful program. And the Arthritis Foundation has funded families to attend the program in the past, which we really appreciate that. And the Arthritis Foundation also pays for kids to go to camp. And we have a couple really fabulous camps here in the state of Florida. We have Camp Boggy Creek, which is over in Eustis, Florida, which is one of the Paul Newman programs. And he started it maybe 12 years ago. And there's also one, Camp Funrise, down in Miami, which is a smaller camp, but it's also just rich in, you know, the ability for kids to meet other kids and realize that they're not alone. And the kids that go to these camps, they come back and they're changed. They are more empowered, they feel stronger, because these kids deal with invisible diseases. And at school they're made fun of, and a lot of kids don't tell other kids that they have arthritis. So if they're not as fast as their friends at school, and they're not able to keep up on testing, or they need to take extra time for completion of assignments, we help them with that. We help them to navigate that pathway as they're going through, from kindergarten through high school.
Yeah, I do remember, you don't think about that at the time, but even from toddler age through to first, second, third grade, when they are disabled to that extent, they can't function in a normal classroom without help. And we were very fortunate that Lily went to a preschool and then to an elementary school where they actually had somebody there for Lily to transport her from one class to the next, so I didn't have to go and do that. And they would just wheel her in a wagon because she couldn't walk. Her writing, for that first 3 years when most kids are drawing and making and doing pictures, she did not have those fine motor skills because she had been delayed so long that even when the medication took effect, it was a catch-up period of time. So yeah, those are the things that you helped us get through. That you don't think about when that diagnosis is first made, but that's ongoing. And to think about kids that are even a little bit older, the ones that are diagnosed as teenagers, I would see that being an even greater impact during school years.
Absolutely.
And to know that they're not the only one, to be able to socialize in those camps would be great.
Right. Yeah, it's a wonderful experience.
Well, I got to tour the one Camp Boggy Creek one time, and you're exactly right. Those kids, and they've made friendships. They go back and forth, email, phone calls, and they've gone to each other's like arthritis walks, jingle bell runs, the fundraisers that we do. It's just amazing what these camps do for the kids and their families. Just amazing. Well, I think it's time to move on and talk a little bit about this wonderful race across America that we've got some folks here, so we can let everybody know about this. As I said, this is a fundraiser that they're doing, and 75% of the donations are going to come back to the Arthritis Foundation. So let me just start with John and Lisa, and Jackie too. She's part of the relay team. And just explain to us, maybe John, what is Team Bacchetta?
Team Bacchetta will be the four of us racing across America to raise awareness to kids with arthritis. And we start off in June 16th and hope to be across in 6 days, non-stop race.
Yep. Well, let's see. I've got some questions here that I was, you all helped me because this is new to me. What you're doing is just amazing. I just can't even believe what you're doing. One of the first questions is, what does mixed mean?
We are riding as a 4-person team, but instead of being all women or all men, we have Jackie on board, 3 men and Jackie.
Okay.
That makes us mixed.
All right, and the 4 racers, I know 2 out of the 2 of you are here, and there's 2 other ones.
Jackie and I, and then we have Larry Ide from Monmouth, Illinois, racing with us, and then Kent Polk up in Largo, Florida, is also on the team.
Did you want to tell a little bit about how you all know each other?
We all know from ultra racing. We've met each other going to these ultra type races, and kind of formed up a looser thing called Team Bacchetta, and we have this goal to get the race across America sometime. It's, when you get to go do a 3,000-mile bike ride, we all kind of, let's do it. And, and then having a purpose for it really helps, for the Arthritis Foundation.
Well, we sure appreciate, obviously, Jackie's heart is in this more than 100%. We feel privileged that it's going to come back and donations back to us, obviously. How exactly do you race with a 4-man team?
We do it as a relay. So there's always a rider on the road, might be out there for 20 minutes, 30 minutes, and then we just switch.
So there'll be two vehicles with 2 racers in each vehicle, and each vehicle takes a 4-hour. And so the 2 racers in that vehicle will alternate every 20 to 30 minutes. And then those 2 go down for 4 hours, and the other vehicle takes over. But there's always somebody riding. So as we pass each other on the road, the next person takes over.
Wow, and that's another important reason why Lisa's on board too. Huh?
Yeah.
Wow. Let's see. I know we're kind of running out of time a little bit, so I'm going to maybe just kind of skip over a few and get to some of the meat of it. Let's see.
I'd like to talk about the crew because they are going to be so important to all of us. We wouldn't be able to do it without them.
Right.
So Lisa, do you want to go into that?
I always tell everybody right up front, I'm not one of the riders. I am on the crew and helping organize, because the crew is behind the 4 riders. Their job is to ride fast. Obviously, they're just going to ride and sleep and eat, and that's it. So the crew takes care of everything else. We have to have a vehicle following the rider all the way across the country, and obviously that vehicle has to have people driving it. They need to be rested. They need to navigate on the course. It gets tricky. The course, obviously, because it's bicycles, stays off of all the major interstates. So we go cross country on not side roads per se, but on the smaller highways, and there's tight places, and meanwhile we're pulling off and swapping the different riders, and so
28 other teams are out there doing the same thing, and
true.
then lots of solo riders at the same time with officials all along the route. So it's imperative that our crew is on top of everything, because if we take a wrong turn and our riders have to go off course and do miles that we didn't have to do, we are not going to be really happy. So we're counting on them for everything.
one of our goals is to have no penalties. Our crew not to make any mistakes that would penalize hours or minutes, or hopefully not any more than that from the team's goal.
Wow, wow.
Another thing that makes us a little bit more unique than the rest of the teams out there, we're racing on recumbent bicycles by Bacchetta, which is who I work for. I'm a partner in, and we're up in St. Petersburg, Florida. And these bikes allow us, if per se we weren't doing this as a relay, as a solo rider, you can stay on the bikes forever without hurting.
And those are the kind of bicycles that you
Just
lay
sit
back
back
on, right?
and relax,
Yes.
right?
Yes.
Not
Look,
exactly relaxed.
I was going to say, for that many miles, because it's a
Well,
total
you still got to pedal. But
it's a total of 3,000, how many miles again? Is the whole
3,000 miles this year.
3,000 miles.
So we'll each be doing 750, as equally as we possibly can.
Right. We'll see who gets the most.
Yeah. Wow.
Yeah, it is the bikes are the secret, though. I mean, that's how we compete in these ultra races and do as well as we do. John just got back from a race that he took the overall win on, and it's because you are really fast but yet really comfortable. So we are hoping to be successful in this venture just because of that.
Yeah. We hope to average over 20.7 miles per hour. We would like to be about 21 mile per hour. That put us below 6 days for this race. So we have a record that I've participated in 2005 for a 4-man team that set the recumbent record. So we want to break that one.
Wow. Oh, goodness. Well,
Might be
Jackie,
good to talk about RAAM itself and what it is.
Yes, please.
Do you want to?
Sure. Well, the Race Across America starts, as you said before, it starts at the pier and ocean side, and it's nonstop for the different kinds of racers that are in it. It's a really unique race. It's not like the Tour de France that people have seen on TV, where they race for a few hours and then sleep and rest till the next day. It just goes nonstop, and whether it's a 4-man team or a solo or an 8-man team, there's all kinds of different bicycles there. Besides recumbents, there's obviously people on the standard upright bikes. There's people, tandems that will do it. I'm not sure if there's any
There's
hand
even
cranks.
disabled teams.
Yeah, the hand crank
Disabled veterans, hand
bikes.
crank bikes. Yeah.
There's professionals, there's amateurs, and so there's all these people. Everybody has a different plan and a different way of getting across America. We're all on the same route, though, so that's...
Do they all have a cause? Like
A lot of them.
A lot of them do.
A bigger majority of them, especially the teams, try to do it for fundraiser projects.
That's good.
If you can get a cause to do it
Right,
for.
right. So if any of our listeners would like to sponsor, we would
Yeah,
all
we can
appreciate it very,
we always
very
need
much.
more help. We have
Yes,
some
and I'm
great
gonna-
sponsors, but we need more.
Yes, absolutely, absolutely. Well, in closing, I want to thank all of the guests today that have participated in this very, very important program about helping us try and conquer this painful, debilitating disease called arthritis. I also want to thank METV for giving us the opportunity to be able to raise awareness and help us with our advocacy mission. And in honor of Mother's Day, which is this Sunday, May 13th, a mother riding for a cure and her mates, any donations would be so very appreciated. And able to donate, you could go to www.teambacchettaram.com. And we really, really, really thank you for this opportunity.